Hi, this is Chris Tech, and
Nils Hakansson.
yeah, welcome to our presentation. The study that we want to focus on is our role to quadruped study. So the background for this is there's really no good quantitative bed mobility test, and sometimes when you do a manual muscle test, especially on the hip, it can it's not always that accurate. So we want to create a test that kind of addresses those things. And in the process, we developed this 30-second roll to quadruped test, and we're seeing it as a potential quantitative measure for frontal plane muscle force production. And it might even help us identify patients who are at risk for injuries like an ACL injury. Do you want to add anything?
I think we're good.
We're good. Rock on. The objective is to test whether there's a correlation between the measured muscle force capabilities and the number of times somebody can roll back and forth. So they're going to start in supine and then roll to quadruped and then go the other way, and we'll see how many times they can do it. It's like a 30-second chair stand test, but we're having people roll into quadruped.
Yeah, they might get dizzy as well.
They might get dizzy. The participant population, we've been working on this test for a few years now. So you'll be entering with some data that we've collected. Some of it is for folks who are over 65. We also did a study with WSU PT students, so let's say 20 to 30. There is an opportunity to pursue different age groups. This one is a little bit fuzzy. We're not yet nailed down in terms of what we're going to pursue.
There's actually also a biomedical engineering master's student who will be working somewhat in parallel, collecting data from ages 35 to 65. So opportunity to work together with some of the technical components and um, yeah, just interact with an engineer.
The methodology, we're going to do manual muscle testing of the upper and lower extremity flexors, extensors, abductors, so all six planes. Record the number of rolls performed in 30 seconds. We're going to qualitatively categorize the rolling technique, and then we're also going to look at their 30-second chair stand test.
Yeah,
Yep. And then the outcome is that we want to be able to determine if there's a correlation between the measured muscle force production and the quality and quantity of rolls within 30 seconds.
that sounds good.
So the if we're to zoom out, the whole point of this is to see if we can develop our own functional test for use in the clinic. And I'll just say I've been practicing for a bit. I use this test with my patients because it seems to do a good job of identifying issues in the hip that otherwise I wouldn't perceive. So I've enjoyed it. I think it's a good thing for my patients, and I'd like to see a broader adoption.
Yeah.
Okay, choose us.